Hello, everyone. The issue in the Senate this week is what are our priorities? We're going to have another show vote in the morning on a tax increase bill styled as a student loan bill that includes what they call the Buffett tax, which Senator Schumer himself has called a political gimmick. My counsel to my members is, why would we want to get on a bill like that clearly is not going anywhere? It would be blue slipped by the House. When we have a bipartisan veterans bill negotiated the way we used to do business in the Senate with members of both parties ready to go. It was introduced yesterday. So I hope we'll not get onto a bill going nowhere and immediately turn to the veterans bipartisan bill and see if we can address that in a bipartisan way very quickly, maybe even finish it this week.
I hope the administration is paying attention to the flood of unaccompanied children who are coming across our southwestern border, who have traversed Mexico, and we don't know how many of them started. We just know how many have gotten to the United States, 47,000 so far since last October. Talking to the authorities at the Border Patrol last week, they expressed grave concern for the conditions for these children as they traverse Mexico, from most of whom come from Central America, and the fact that they are committed to the tender mercies of the drug cartels and other human smugglers, and mixed up within the population were included at least 200 convicted sex offenders. I just don't think the administration has realized that its policies of deferred action have been, for minors, have created a magnet, a human magnet, for these children to come at great risk themselves, and some of whom don't make it. And there is no plan in place to deal with this humanitarian crisis of perhaps as many as 60,000 unaccompanied minors making their way to the United States this year. We don't know how big it's going to get, but that's the current estimate. So I hope the President will tell us promptly what he plans to do and how he intends to engage Congress to deal with this humanitarian crisis and to create a system that does not represent a magnet for these children to be exposed to this great risk.
Well, as the leader mentioned, we've got a VA bill that appears to be pretty much ready to go, and the House of Representatives just a little while ago passed their version of it by a vote of 421 to 0. So there's a lot of bipartisan support for fixing the crisis that we have with the VA. And yet here we are on the floor of the Senate dealing with yet another election year designed to fail bill that the Senate Democrats have put forward. Does the legislation that they have on the floor right now do anything to lower college education costs? No. Does it do anything to reduce the amount that a college student needs to borrow to get a college education? No. Does it do anything to create jobs for those graduates when they get through with their college education? No. I mean, this is a bill that purely and simply is an election year bill that allows them to check a box. And what we need to be focused on are not political gimmicks, but jobs. College graduates, what they need, they don't need political gimmicks. They need jobs when they get out. And this bill would actually have the exact opposite effect, because it includes a $72 billion tax increase, which would make it harder to create jobs and harder for those college graduates to get the jobs that they need. And you look at the number of people in 2012 and 2013, more than half of the graduates who finished their education in those 2 years are without full-time jobs. And so that's the issue. The issue is jobs. And we need to be doing everything we can to focus like a laser on the economy and getting growth back in our economy and creating good-paying jobs for college graduates instead of messing around with election year gimmicks that do nothing but try and allow the Democrats to check a box.
As part of my medical training, I spent a lot of time at VA hospitals in different parts of the country, having a chance to take care of the men and women who continue to fight to keep us safe and free, and to hear their incredible stories. I will tell you, it is sickening when you hear that 57,000 veterans waited more than 90 days for the first appointment. 63,000 veterans never got to see a doctor at the VA hospital. When 13% of the people who worked the scheduling that they were told to falsify information. And then you read that the team of doctors who were supposed to be sent out to the most troubled VA hospitals to try to improve them, that program was paused. It's sickening to see this. And I will tell you, as a doctor, delays make a difference in terms of people's ability to get treatment and to get care and to heal. So when I look at the Obama administration and what it's doing here, I will tell you to just slap on the wrist or to say we're going to cancel bonuses, that is absolutely not enough. If the President is serious about addressing the issue of the VA, it's time to see people being fired. It's time to prosecute. And I think anything less than that would be a dereliction of duty by the President of the United States.
Well, following up on what Dr. Barrasso said, clearly people are and should be outraged by the way the VA has treated our veterans. 57,000 people, I'll repeat that number again, couldn't see somebody for the first time for 90 days. St. Louis, one of our hospitals in Missouri, was on that list of some of the longest waiting times. I was there last week, a whistleblower alleging that people who are supposed to see mental health patients are seeing about half of the number they'd see in any other setting. At the Truman Hospital in Columbia, at the Kansas City Hospital, the same kinds of problems. I want to know exactly what those waiting lists are. Last week I was able to say that we had found out about a secret waiting list or an unauthorized list in Kansas City. These things have come to a point that people want to see something done, and they have every reason to ask the Senate, why aren't you doing what we need to do and can do, and there is a bipartisan willingness to do for our veterans, rather than bringing bills to the floor that everybody knows can't possibly pass and putting off one more week where the Senate does nothing when the country is ready to see the Senate, the Congress, and the President do for our veterans what not only can be done, but what there's a current willingness to do. Give them options they've never had before so they can get treatment like they've not been able to get treatment before.
Yeah. Say that again. The defense bill has what?
The defense bill would appropriate such sums as are necessary to carry out this act through FY16. So my question is that how do you justify a check?
Well, we'll take a look at that when we get to the floor. Yeah.
Do you support the use of repatriated corporate earnings to replenish the highway trust fund?
Well, we've had an interesting discussion about how to pay for the Highway Trust Fund, and there is a considerable discussion about the need, the opportunity to bring home overseas profits and to use that as a way to gain additional revenue to pay for the transportation extension. It enjoys a good deal of support in our conference, and we're certainly in the middle of having the discussion and open to talking about it.
Do you worry about the moral hazard it might create for corporations?
A moral hazard?
Well, I mean, if corporations know that another tax holiday might just be around the corner, they may not have the incentive.
Well, the moral hazard is leaving $2 trillion in overseas profits because of our completely inept tax system. We ought to do comprehensive tax reform. We're the only country in the world, we're now the only country in the world with the highest corporate tax rate, and the way we tax overseas profits encourage them to stay over there. So figuring a way to get those profits home and dedicating that money to a good purpose is something we've had a number of discussions about.
You mentioned that Kentucky should be allowed to keep Connect in the event that Obamacare is repealed. Once it's repealed, should the subsidies come from the state, or should it be replaced with a federal program?
Yeah, we've already addressed that whole issue about 10 days ago, and I really don't have anything to add to it. Yeah.
Judicial Watch is now suing the Department of Defense and State Director about Benghazi, who thinks that congressional leaders specifically out of the Super 8. And Senator Chambliss did mention to me that the CIA annex, he was aware of it before the attack, whereas Senator Feinstein was not aware of it before the attack. And that being said, were you briefed about the CIA annex before the attack on Benghazi now since Judicial Watch is suing for these briefings?
Are you talking about Benghazi? No, I heard about the Benghazi episode when it happened.
But did you know about the CIA annex before the attack actually happened?
Did I know what?
About the annex,
CIA annex before the attack?
the CIA annex in Gaza.
I don't remember being briefed about it now. Okay, thanks, everybody.